When you hear the word hospital, you think about four walls and an operating room and maybe a patient room. When you say the word St. Joe's Hospital, I don't think of walls and rooms and operating rooms. I think of a neighborhood. I think of a community that is engaged and part of really important work.
I think it's part of the Central New York philosophy. It's hard to be born here, raised here, and not care about your neighbors.
St. Joe's is founded on caring for more than just a person. Compassion, care for every person, every time.
Our goal is to serve the community today just as it was 150 years ago, with the best technical care possible and with compassion.
They're committed to neighborhood revitalization, but they do it in partnership with the neighbors. So it's not happening to the neighborhood, but it's happening with them. The neighbors are active participants in what happens in terms of revitalizing that community.
They see a need and they work to fill a need. They're on the near west side, they're on the north side. They're really working to revitalize these communities that other people maybe have overlooked.
It all comes together in the end, and being able to support new housing, employment opportunities, creating a better environment only benefits St. Joseph's and the work that we're trying to do in the long run.
St. Joe's, in partnership with CenterState CEO, has developed a program called Health Train that allows people to get trained, have an opportunity to work for one of the largest employers in town, and then live in the same community that they work in. Businesses develop or generate because of these new employees. So it's kind of like this phenomenal domino effect. We start with a hospital that develops, and then employment opportunities, business opportunities, housing. It's a very comprehensive approach to neighborhood revitalization.
Nursing has changed my life. It's changed my life for my family, for myself, and for my community. 10 years ago, I was living in Syracuse housing. I was dreaming about the life I have now, and I couldn't have that without my education and without a career in nursing. And St. Joe's has been helpful in every step of the way.
Over 500 family physicians have graduated from our programs, over 5,000 nurses from our College of Nursing. It's really critical to make sure that we keep growing those programs. It's more than our personal careers or institutions. We have to look beyond the walls. We want to be so much more than just a hospital to Central New York.